Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, Mrs. Johnson. I see you've come in today because of some worrying symptoms you've been experiencing. Could you start by telling me about the main issue you're facing?
Yes, doctor. Over the past few weeks, I've been having these severe chest pains that come and go. They're quite sharp and sometimes feel like a heavy pressure. It's been quite scary.
I'm sorry to hear that. Can you describe when these pains occur? Is it during physical activity, or does it happen at rest as well?
It mostly happens when I'm climbing stairs or carrying something heavy, but there have been a couple of times when it occurred while I was sitting down, reading or watching TV.
Do you experience any other symptoms during these episodes, like shortness of breath, dizziness, or palpitations?
Yes, I do feel short of breath and sometimes dizzy. No palpitations, but it definitely feels like my heart is straining.
Given these symptoms, we need to consider serious cardiovascular issues. Have you had any previous heart conditions, or is there a family history of heart disease?
My father had something called hypertrophic cardiomyopathy, and he was quite ill for many years. I've never been diagnosed with it, though.
That's an important family history to note. Hypertrophic cardiomyopathy can be hereditary, and the symptoms you're describing could be related. Have you noticed any swelling in your legs or feet? Any night coughs or bouts of waking up breathless?
Actually, yes. My ankles do swell by the end of the day, and there have been a few nights I woke up feeling like I couldn't catch my breath until I sat up.
Those are signs that can also suggest congestive heart failure, which can sometimes be a complication of untreated hypertrophic cardiomyopathy. We will need to perform an echocardiogram to look at your heart structure and function. We should also consider a chest X-ray and some blood tests to check for cardiac biomarkers.
That sounds serious, doctor. What are we looking at in terms of treatment if these tests come back confirming your suspicions?
Treatment can vary significantly based on the specific findings, but generally it involves managing the symptoms and preventing further complications. This can include medications like beta blockers or ACE inhibitors, lifestyle modifications, and in some cases, surgical interventions might be necessary.
I understand. Is there anything I can do in the meantime to manage these symptoms or reduce the risk?
Absolutely. It's important to avoid strenuous activity until we have more clarity on your diagnosis. Also, managing your diet to reduce salt intake can help decrease fluid buildup, and if you're a smoker, quitting smoking will be crucial.
I quit smoking 2 years ago, but I will watch my diet and take it easy on the physical activities. How soon can we do these tests, doctor? I am quite worried.
We'll schedule them as soon as possible, likely within the next few days. We need to understand what's happening quickly to manage it effectively.
Thank you, doctor. I'm anxious about this, but glad we're getting to the bottom of it.
You're doing the right thing by addressing these symptoms early. We'll take it step by step and make sure you receive the best care possible based on the results. I'll be here to guide you through all the upcoming steps and treatment options.
I appreciate that, doctor. I hope we can sort this out soon. The uncertainty is quite distressing.
We'll work together on this, Mrs. Johnson. Your health is our utmost priority, and we'll proceed carefully with thorough testing and consultations. Let's set up a follow-up appointment to discuss the test results as soon as they are available.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon, doctor.
Good afternoon. How can I assist you today?
I've been experiencing some severe pain and stiffness in my lower back and hips, especially in the morning or after sitting for a long time.
I see. How long have you been experiencing these symptoms?
It started mildly about 6 months ago, but has progressively gotten worse. Now it's quite debilitating in the mornings.
Do you have any other symptoms, perhaps eye problems, skin rashes, or gastrointestinal issues?
Yes, actually, I've noticed some redness and pain in my eyes occasionally, and I do have a patch of scaly skin on my elbow that seems to get red and itchy at times.
How old are you, if you don't mind me asking?
I'm 35 years old.
Do you have any chronic conditions we should be aware of, or are you currently taking any medications?
No chronic conditions, and I'm not on any medication regularly, just occasional ibuprofen for the pain.
Have you had any previous surgeries or significant injuries?
Nothing significant, just minor sports injuries over the years.
Any allergies to medications?
None that I'm aware of.
And what about your family history? Any similar symptoms or autoimmune diseases?
My father has psoriasis, and my grandmother had something she called rheumatism, but I'm not sure what exactly it was.
Given your symptoms and family history, I'm concerned about a few possibilities, including ankylosing spondylitis or possibly psoriatic arthritis. These conditions can explain both your joint symptoms and the skin and eye issues.
What are those conditions exactly?
Ankylosing spondylitis is a type of inflammatory arthritis that primarily affects the spine and the sacroiliac joints in the pelvis, causing pain and stiffness in the back. Psoriatic arthritis is another form of inflammatory arthritis linked to the skin condition psoriasis, which could explain the scaly skin patches. Both conditions are autoimmune in nature.
What should we do next?
We should conduct some diagnostic tests. I'd recommend blood tests to check for inflammation markers and HLA-B27, a genetic marker associated with ankylosing spondylitis. We should also consider X-rays of your back and pelvis, and perhaps an MRI to get a clearer picture of your joints and any inflammation.
And what about treatment? What are the options?
The treatment will depend on the specific diagnosis, but generally it includes medication to reduce inflammation and manage pain. This can be NSAIDs, like the ibuprofen you've been taking, but also more targeted therapies, like biologic medications. Physical therapy is also crucial to maintain mobility and manage symptoms.
Is there anything I should do in the meantime to manage the symptoms?
Yes, regular exercise, especially swimming or gentle stretching, can help. Try to maintain a good posture and avoid staying in one position for too long. Applying heat to stiff areas in the morning can also ease your symptoms.
What about the skin and eye issues?
A referral to a dermatologist for the skin evaluation would be helpful. They might recommend topical treatments or light therapy. For the eyes, I recommend seeing an ophthalmologist to prevent complications. Both could be related to an underlying autoimmune disorder.
It sounds serious. Is it something that can be managed?
Yes, with the right treatment plan and regular monitoring, many people manage their symptoms well and maintain a good quality of life. It's crucial to start treatment early to avoid complications, especially with the spine and joints.
I understand. Thank you for explaining everything so clearly. I'll follow up with the tests and appointments.
You're welcome. It's important to address these symptoms early, and I'm here to help you through this process. We'll review everything once we have the test results and make sure we choose the best treatment path for you.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
In terms of diabetes management, regular monitoring and lifestyle adjustments are essential. We've seen a decrease in complications when patients engage actively with their treatment plans. The real-time glucose monitors we've implemented have significantly reduced severe hypoglycemic episodes.
Absolutely. These technological advancements in monitoring provide us with better data to make informed decisions. However, I've noticed that some patients struggle with the adjustment to technology. It's a learning curve for many, especially the elderly.
That's a valid point. Perhaps we should consider more personalized training sessions to help these patients better understand how to use these devices. The goal is to empower them, not overwhelm them.
I agree. It might be beneficial to involve family members in these training sessions as well. A supportive environment can make a huge difference in patient compliance and overall comfort with new technology.
Now look at question 26.
I've been reviewing the recent data on antibiotic resistance in our hospital, and the trend is concerning. The misuse of antibiotics in non-critical cases is still prevalent despite our efforts.
It's frustrating indeed. We need to tighten our antibiotic stewardship programs and ensure that all prescribing doctors are adhering to the guidelines. Have you thought about increasing the audits on antibiotic prescriptions?
Yes, I've proposed quarterly audits and also suggested implementing mandatory training on antibiotic resistance for all new medical staff. It's crucial that everyone understands the gravity of the situation.
Those are great steps. Perhaps we should also include regular feedback sessions where prescribers can discuss challenging cases and get advice on alternative treatments. That could foster a more collaborative approach to reducing antibiotic use.
That's a fantastic idea. Engaging our staff in ongoing education and discussions can definitely help in changing prescribing behaviors.
Now look at question 27.
Could you help me understand the new dietary restrictions for cardiac patients?
Certainly, the main focus is on reducing sodium intake and limiting saturated fats and cholesterol. It's about promoting heart health through balanced meals.
I see. My father was recently advised to follow these guidelines. Are there resources or specific meal plans that can help him adjust?
Yes, we have dietitians on staff who can create personalized meal plans for him. They can also provide guidance on how to read nutrition labels and make healthier choices when grocery shopping.
That sounds helpful. Can I set up an appointment with a dietitian for him?
Of course, I'll arrange that for you. They can meet with him this week and get started on a plan that suits his health needs and preferences.
Now look at question 28.
The upcoming flu season is approaching, and it's crucial we discuss our vaccination strategy. I believe it's vital we improve our outreach this year, especially to high-risk groups.
Agreed. Last year we saw a lower turnout than expected. Do we have plans to partner with local community centers this time?
Yes, that's part of the strategy. We're also considering setting up mobile vaccination units in underserved areas to increase accessibility.
Mobile units sound like a great idea. What about staffing? Will we need additional volunteers or part-time staff?
We're currently recruiting additional nurses and have reached out to medical schools for volunteer students. It's crucial that we have enough hands on deck to manage the anticipated numbers.
Sounds like a solid plan. Let's make sure we have a detailed schedule in place so everyone knows where they need to be and when.
Absolutely. I'll circulate a draft schedule by the end of the week for everyone's input.
Now look at question 29.
The patient in room 204 has been reporting persistent nausea after chemotherapy. Have we adjusted his medication to manage this?
Yes, we've prescribed an antiemetic to help with the nausea. It should take effect soon.
Excellent. Also, can we ensure that he receives his meals in smaller, more frequent portions? It might help manage his nausea better.
I will arrange that with the dietary team. We can start this new meal plan by this evening.
Good thinking. Let's keep monitoring his condition and make sure we're proactive with any further adjustments.
Now look at question 30.
I noticed that the new batch of flu vaccines has arrived. Have we scheduled a staff vaccination day yet?
Not yet. I was thinking we could set it up for next Friday. That way most of the staff will be available.
That sounds like a plan. It's critical we get everyone vaccinated early, especially with flu season around the corner. Should we include a reminder in the staff newsletter?
Yes, let's do that. And maybe we can set up a sign-up sheet in the break room to help organize the times.
Perfect. I'll get the communications team to handle the newsletter and the sign-up sheet today.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1.
Today, we're diving deep into the realm of genetic therapies for cystic fibrosis, CF, a genetic disorder known for affecting the lungs and digestive system. We will explore a specific case study involving an innovative gene therapy treatment.
Cystic fibrosis is a serious condition. Could you first explain the genetic basis of CF and the traditional methods of management?
Cystic fibrosis is caused by mutations in the CFTR gene, which affects the protein responsible for regulating salt and water transport in cells. Traditionally, CF management has focused on symptomatic treatment, using medications to thin mucus, antibiotics to treat infections, and physiotherapy to improve lung function. However, these treatments don't address the underlying genetic problem.
What advancements have been made in genetic therapies for CF?
Recent years have seen remarkable progress in developing genetic therapies aimed at correcting the faulty CFTR gene itself. These include gene therapy, which introduces a correct copy of the gene into the patient's cells, and mRNA therapies that provide a temporary template for making the functional CFTR protein. These therapies aim not just to treat, but potentially to cure or significantly alter the disease course.
Could you provide details from the case study you mentioned?
Absolutely. The case involves Alex, a 20-year-old with a severe form of cystic fibrosis, who was part of a clinical trial for a new gene therapy. Alex's treatment involved a series of intravenous administrations of a vector carrying a correct version of the CFTR gene. The goal was to introduce the gene into his lung cells to restore proper function.
How effective was this gene therapy in Alex's case?
Alex showed significant improvement in lung function and a reduction in pulmonary infections over 6 months post-therapy. This improvement suggests that the therapy was successful in altering the cellular function in his lungs. It's a promising sign that gene therapy could provide a long-term benefit for CF patients.
What are the broader implications of this treatment for CF and other genetic diseases?
Alex's positive response to the gene therapy highlights the potential of genetic treatments to provide sustainable solutions for genetic disorders, not just managing symptoms but addressing the root cause. This approach could revolutionize treatment for CF and other similar genetic conditions by potentially offering a one-time therapy that could lead to prolonged or permanent relief.
Considering the complexities of such treatments, what challenges remain in the field of genetic therapy for CF?
While the initial results of the therapy are indeed promising, there are several significant challenges that must be thoroughly addressed to ensure its successful implementation. One of the foremost concerns is the long-term safety and efficacy of the therapy, as ongoing studies and trials are crucial to fully understand its impacts over an extended period. Additionally, there is the issue of the body's potential immune response to the vector used in the therapy, which could complicate treatment and affect its overall effectiveness. Another major challenge lies in the high costs associated with the development and administration of these treatments, which could limit accessibility and availability to patients who need them most. Moreover, due to genetic variability in cystic fibrosis, different mutations may respond differently to the same therapeutic approach, necessitating a more tailored or personalized treatment strategy to accommodate the diverse genetic landscape of this condition. This complexity requires a multifaceted approach to research and development, emphasizing the need for robust funding and innovative solutions to overcome these hurdles.
This discussion underscores the importance of continued research and innovation in treating cystic fibrosis. Thank you for shedding light on these exciting developments in genetic therapy.
Thank you for having me. It's an exciting time in the field of genetic research, and continued support and funding for these initiatives are crucial as we move closer to more definitive therapies for cystic fibrosis and other genetic disorders.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Good day, everyone. I'm Dr. Edward Langston, and today we will delve into the complexities of immunotherapy in the treatment of autoimmune diseases, particularly focusing on the use of checkpoint inhibitors. This field has seen remarkable progress over recent years, moving beyond traditional immunosuppressive therapies to more targeted approaches that can modulate the immune system with greater precision. Autoimmune diseases arise from an inappropriate immune response of the body against substances and tissues normally present in the body. This may be restricted to certain organs or involve a particular tissue in different places. The traditional treatment paradigm has been to suppress the immune system to reduce the severity of the response. However, newer strategies involve refining this approach to avoid broad immunosuppression, instead targeting specific components of the immune system to reduce disease activity without compromising the body's ability to fight infections and other diseases. Checkpoint inhibitors have revolutionized cancer therapy by blocking proteins that prevent T cells from attacking tumor cells. Interestingly, these proteins also play a role in preventing autoimmune attacks, and researchers are now investigating how these drugs can be repurposed to treat severe autoimmune diseases. These treatments offer the potential to reset the immune system, providing relief from symptoms and possibly leading to longer-term remission. Consider the case of a patient, whom we'll call Sarah, a 34-year-old diagnosed with systemic lupus erythematosus, SLE, a chronic autoimmune condition that affects the skin, joints, kidneys, brain, and other organs. Sarah was experiencing frequent flares that significantly impacted her quality of life. Traditional therapies, including corticosteroids and immunosuppressants, were only partially effective and came with significant side effects. Sarah was selected to participate in a clinical trial exploring the efficacy of a PD-1 inhibitor, a type of checkpoint inhibitor. PD-1 inhibitors work by blocking the protein PD-1, which normally helps keep immune cells from attacking other cells in the body. By inhibiting this checkpoint, the idea is to selectively modulate the immune response without broad immunosuppression. Throughout the trial, Sarah's condition was closely monitored using a range of biomarkers to assess immune activity and inflammation. Over several months, Sarah reported a significant reduction in the frequency and severity of her flares. Laboratory tests also showed a decrease in markers of inflammation. This promising response highlights the potential of checkpoint inhibitors to change the landscape of treatment for autoimmune diseases. However, the use of such therapies is not without risks. These treatments can potentially lead to an overactive immune response, resulting in side effects such as colitis, hepatitis, and endocrinopathies. Patient selection, therefore, becomes crucial, and identifying biomarkers that can predict response to therapy is an ongoing area of research. Moreover, the economic implications of these advanced therapies cannot be overlooked. Checkpoint inhibitors are notoriously expensive, and their use in autoimmune diseases could lead to significant healthcare costs. Health economic studies are being integrated into clinical trials to better understand the cost-effectiveness of these treatments compared to traditional therapies. While the use of checkpoint inhibitors in autoimmune diseases is still at an experimental stage, the initial results are promising. This approach could potentially transform the treatment paradigm for patients like Sarah, who suffer from severe and treatment-resistant forms of autoimmune diseases. Ongoing research into the mechanisms of action, long-term safety, and cost-effectiveness of these therapies will be crucial in determining their role in clinical practice.